Hello everyone. Today we discuss about case study on diabetes mellitus. Subject is OBG. How to make case study on diabetes mellitus. इसमें सबसे पहले बायोग्राफिक डाटा आता है. नेम ऑफ पेशेंट, एज, सेक्स, ऑक्यूपेशन, एड्रेस, मैरिज स्टेटस, एडमिशन, डेट ऑफ एडमिशन, डायग्नोज डायबिटीज mellitus. नेक्स्ट इसमें प्रेजेंट मेडिकल हिस्ट्री. पेशेंट एडमिटेड टू हॉस्पिटल विथ क्लासिकल सिम्टम, weight loss. Other symptoms that may suggest hyperglycemia include blurry vision, yeast infection. Present surgical history. Patient has no surgical history in present. Past medical history. There has no past medical history. Past surgical history. No past surgical history. Then it come to family history. It includes serial number, name, age, sex, relation to patient, and health status. These are the family members, family history. Then it come to next to family tree. Family tree we have to make like this family tree. Then it come to socioeconomic history. Patient is living in concrete house as family income is around 10,000 per month. Then next is physical examination. Anthropometric measurement. It include weight, height, vital, temperature in 98, pulse 100, respiration 18, beat respiratory rate RR, general appearance, consciousness, body build, head, hair, scalp, face. Next it come to eyes, visual activity normal, lips clear, conjunctiva pale, ear, hearing normal, mucous membrane no discharge, nose, external structure short, round, spoot, septum, oral cavity, lips, gum, teeth, neck, general structure, rows of range of motion is fine. Then it come to personal history, hygiene maintained, diet vegetarian, sleep and rest, 8 hour elimination pattern, chest and respiration, chest and shape, symmetrical, breathe sound, next abdomen, hair, scar, bladder, diabetes mellitus is characterized. Then we have to write the definition of the diabetes mellitus in case study. Diabetes mellitus is characterized by the abnormally high level of sugar in the blood when the amount of glucose in the blood increased. This is introduction. This is definition. This is in which the body does not control the amount of glucose in the blood and kidney make a large amount of urine. Causes weight, inactivity, family history, race of activity, age, gestational diabetes, high blood pressure. Its prevention: lose extra weight, be more physically active, eat healthy plant food, eat healthy fat, skip fat diet, make healthier management. People with diabetes must take responsibility for their day-to-day care. This includes monitoring blood glucose level, dietary management, maintaining physical activity, keeping weight and stress under control, monitoring and medication, and require insulin use via injection or pump. Component of diabetes. Step 1, monitor your glucose. Past of having diabetes, you know how to monitor your glucose. Step 2, take your medication. Be mindful of food choices. Step 4, get up morning. Keep your doctor appointment. Step 5. Next it come to the nursing diagnose. First nursing diagnose risk for deficient fluid vulnerability to polyemia, polyuria, bone hydration. Secondary risk for electrolyte imbalance related to fluid loss or shift. Third is deficient knowledge about diabetes, self-care, skill or information. Fourth is anxiety related to loss of control, fear of inability to manage diabetes, misinformation related to diabetes, risk of infection due to injury from cheap soap object. Then the first nursing diagnose include assessment, nursing diagnose, goal, planning, implementation. First, subjective data. I want to know more about the disease. Objective data. Patient has no knowledge about disease. Nursing diagnosis. Deficient knowledge about diabetes. Goal. To give knowledge to the patient about the diabetes and make patient feel comfortable. Planning. First, assess the patient understanding of diabetes mellitus. Provide education about the basic skill. Again, two part, point to point. Educate the patient about need of blood glucose at normal level. Implementation. Patient understand adherence of diabetes mellitus. Education about basic skill is given. Education to maintain normal glucose level is patient. Evaluation. Now patient is able to understand how the diabetes mellitus knowledge. Second, NCP subjective data. Patient says he has felt anxiety and depression. Objective data. Patient look like first taking tension. Nursing diagnose anxiety related to loss of control. Goal to reduce the anxiety of the patient. Intervention. Educate the patient. Strategies may be useful for reducing tension. Assess the vital sign of the patient. Give advice the patient concentrate on the pleasant experience. Implementation. Patient is educated to use conjunctive with the giving him joy. Vital sign are assessed. Patient give comfortable position and experience. Now the patient is free from anxiety. Then it come to the third assessment. Nursing diagnose goal, planning, implementation, evaluation, subjective data. First it come to subjective data. Patient is feeling low and energetic. Objective data is patient look like tired. Nursing data to maintain fluid and electrolyte balance. Make fluid and electrolyte balance goal. Planning, measure output input, give IV fluid, electrolyte, monitor vital signs of the patient and assess the breathing sound of the patient. Output ensured IV fluid is given, vital signs are monitored, and assessment of breath is done. Then the patient feel comfortable after the fluid and electrolyte are taken. Then is next come to health education. Encourage the to take adequate rest and sleep. Provide calm and comfortable environment to patient. Ask the client do not more with sleeps. Educate the mother to keep surrounding clean. So this is how you have to make your OBG case study on diabetes mellitus. Hope you enjoy this video. So follow my channel, like the video and share this information to your friends. Thank you.